Go to Masterton Hospital and talk to the nurses there. They tell us that they're 40 nurses short and they're not allowed to recruit.
We spoke with a cardiologist at Tauranga Hospital who's about to start his last shift. Dr Dean Boddington told us he's had enough, quitting because of burnout after being forced to take on extra workload due to staff shortages, and told by management there was no money to replace a former colleague. He says the sector is at a crisis point and Health Commissioner Lester Levy is in, quote, la-la land. Joining us now on our political panel this morning, Finance Minister Nicola Willis and Labour's Kieran McAnulty. Good morning to you both. Thank you both, as always, for being with us this morning. Nicola, I wonder if I can start with you. Our health system is stuffed, and those who are suffering are us, right? They are the public.
So we are taking action. We've announced that we're designing a new fast track so that doctors coming with relevant qualifications from overseas can quickly be onboarded. That process can take up to 6 months at the moment. We need to do it faster to take. We have invested considerable billions in the health system, and I've committed that in our next budget, more than half of the new funding will be for health, because it is critical that we keep putting that money into the front line.
The thing is, though, is that many health professionals that we've spoken to have talked about the changes that are being made and the budget cuts, right? And so taking services from the back office, they're actually having an impact on the front line. So, you know, yes, it's all good to take the money away and say that you're focusing on the front line, but actually the front line is the one that is also being impacted here, who are suffering. And you have doctors like Dr Boddington who say, you know what, I've had enough, can't cope. And again, who's the one that loses out? It is the New Zealand public, Minister.
Well, look, I'd just say, Jenny May, I don't like seeing anyone burn out, but he pointed out himself this is a 2.5-year issue he's faced. We're a government that's been in for 10 months. We have actually increased funding for health considerably by an additional $1.4 billion in the budget. And as I say, we've committed more funding in all of our future budgets. So this isn't about reducing funding for health. It's about making sure that we can hire those doctors who have been in shortage.
This is an issue that could have been dealt with under your government.
Well, the reforms are a massive part of that. We can't forget how the DHB system was failing New Zealand. I only need to look at back home in Wairarapa. We had the second smallest DHB in the country. People in Eketahuna weren't able to access their nearest hospital because of an arbitrary boundary. If people in Wairarapa needed to access healthcare in Wellington, we were at the back of the queue because Wellington people got treated first. That is not how health systems should be working in this country. Now, a reform of that size is always going to take time. But I still don't think the response from the Minister is going to wash with New Zealanders. They promised us that their cuts wouldn't impact the front line. Go to Masterton Hospital and talk to the nurses there. They tell us that they're 40 nurses short and they're not allowed to recruit. The government tells us there's no hiring freeze on, yet if you go to the hospital and talk to the people that actually work there, they tell you a different story. Our orthopaedic surgery's been pulled back because of resignations. There's been no promise to replace them. Radiology is going to get cut next month. And there's also a massive concern about a court settlement about Masterton Hospital up to $90 million to fix our hospital, and the money's disappeared. So you can be as reassuring as you like, but actually where it matters on the front line, when people go into emergency rooms and are waiting way longer than they used to, those responses simply don't cut it.
Yes, the Labor government tried to bring in reforms. The coalition government comes in, those reforms are put to one side. Why can't we just find a solution for this? So why can't parties work together to solve this issue?
Well, actually, Jenny May, what our government did choose to do was take the reforms that Labor had put in place and work with them.
Kieran, can we solve this as a whole of government?
Well, I'd love to think we could. I mean, at the end of the day, we're talking about people's health here.
Yeah.
And there is an expectation amongst New Zealanders that if they need treatment, they can go to their emergency department, they can get seen in a reasonable period of time, and that the people that are looking after them, who do a tremendous job, and in fact, everybody that gets in touch with us about concerns about the health system never complain about the nurses and doctors. They're tremendous, but they're overworked, they're under the pump, they simply cannot treat people as quickly as they would like because there aren't enough of them, or in our case in Masterton there isn't enough space. So it's a double whammy there. Yes, that'd be brilliant if there was a bipartisan support, but in order to be able to do that, there needs to be agreement across Parliament that there needs to be a continued stream of funding at an agreed rate where there isn't cuts, there isn't promises like no hiring freeze that isn't reflected on the front line, and there isn't promises that cuts won't affect the front line when the reality isn't actually the case.